So there's something you need to know about. High blood pressure. You know, we live crazy lives and sometimes this happens. I think it might be related. We're going to find out. Karen Russell, nice to have you with us. Mountain Valley Regional Rehabilitation Hospital. Yes, Prescott Valley, a great facility, a lot of great therapy and things going on over there.
I love it there. We've been there 12 years now, so yeah, it's a wonderful place to work.
Well, you know, you take care of people in all kinds of situations, get them back on their feet, get them going, that kind of thing. But, you know, blood pressure is something that is a good thing to be aware of, too, because I guess we have to figure out how to keep it in a normal range. Tell us a little bit, how do you define, you know, blood pressure?
Well,
what are those numbers?
And we treat a lot of individuals that have underlying issues that develop because of blood pressure. So whether it be stroke, cardiac issues, so we actually do see a lot of individuals that require some medical management with their blood pressure. Blood pressure is the pressure against the arterial walls as the blood circulates. So when you get your blood pressure taken, you have the top number and the bottom number. The top number is your systolic pressure, and that is the pressure against the arterial walls when the heart is contracting. Okay. And then the bottom number is your diastolic, which is when your heart is at rest. And so we look at those two numbers because both will give us different information.
Okay, so let's say that we do have, because, okay, so optimal, tell us what is the optimal range, or is there one for what those numbers should be?
Yeah, they keep changing that. Right now, I think they're still really looking at the 120/80 as kind of your optimal. And then depending on where you are at, they might add medications and things. So anything 130 on your systolic, they're going to probably start looking at dietary changes, probably not medication management at that point. But we also look at your diastolic, because diastolic is when your heart is at rest. So when that diastolic starts creeping up, that's not a good sign, because that's when your heart is at rest, so you really shouldn't have a lot of pressure.
Shouldn't be racing and have all that thing going.
Yeah, and there's certain situations where we expect blood pressure to be elevating and changing. Exercise will change your systolic, because obviously your heart is working harder, so we expect the systolic to go up.
More blood is going through those veins.
Right. But diastolic usually should be pretty even, because again, that's when your heart is at rest.
I love it. Now you're going to do this for me. We're going to find out, you know, if I have high blood pressure, if I'm doing pretty good. This job might make me crazy.
Do you really want me to announce your blood pressure on the air?
Yes, because I have an idea what it might be.
Now, this is kind of more old school. You're going to find that most doctors' offices and people at home, they usually aren't going to use the blood pressure cuff and the stethoscope anymore. I actually, for the most part, if this is done correctly, I feel that this is probably more accurate, but the machines are just as accurate as well. So,
okay,
again,
with machines, they don't use a cuff then?
They do use a cuff. It's just that it's automated, and the machine is going to do the work listening for your blood pressure.
Gotcha.
Yeah, so it's
I've seen those. They go up, they go down,
and right. Okay. So instead of a person listening for it, what I'm listening for is your pulse. So I'm going to listen for your pulse when it starts to kick in, and then I'm going to look and listen to your pulse as it fades away, and that's going to give me the two numbers.
Gotcha. Okay.
So when you do something like this, normally I would shove this up, but I won't do that. And we're going to put this on somewhat snug. You want, whether it's a machine or manual, you want to be able to tug on this and not have it move a lot. So it should be somewhat snug. And I'm going to make sure this is tight. I've got my handy dandy stethoscope. We'll see how this works on air. I don't know. Okay. And I'm going to be looking for this. This is where I'm going to be looking for your brachial artery. And I'm going to start to pump.
I hope I have one. You better. Okay, now it gets really tight.
It gets very tight.
Like suffocates your arm.
Sometimes it's uncomfortable.
I'm trying to be quiet so you can hear. This is counting. Don't let me distract you. Because now the pressure kind of releases, and then the dial will give us
down.
Okay, it'll give us. All right. So what do you think?
A little harder on air, and through your clothing, I got about 110/75. But I'm not sure. Again, it was a little harder because over the clothing, I didn't hear it as strong.
You're pretty close. I have very low blood pressure. I had one doctor tell me that you're going to live forever. So.
Well, and that's the tricky part about blood pressure is you want to keep a log of it. So you don't necessarily want to go by one blood pressure reading because it is going to go up and down. And especially if you go to your doctors, there is such a thing called white coat blood pressure or high blood pressure.
Oh, where you're more nervous?
Yes. So it's not uncommon when you go to the doctor's office that your blood pressure may be really super high. So don't panic if at the doctor's your blood pressure is high because for some individuals that is normal.
I kind of go,
yeah.
I try to do the trance thing. I like really calm down and just try to make it go really, really slow. Because I think that's a very, you know, I mean, it's interesting to do, but obviously very good. So if you have high blood pressure, what are some risks of that? Why is that bad?
Cardiac disease, so it puts you more at risk for cardiovascular issues, heart failure, heart attacks. One of the biggest ones is stroke. What people don't realize is it's a silent killer. So a lot of people, it's asymptomatic. So they don't really understand the seriousness of what the damage is high blood pressure is doing to their body. And what high blood pressure does, because of that constant pressure against the arterial walls, it damages them. So it can weaken those arterial walls, putting you more at risk for a rupture of the vessel, which is going to lead to a stroke. It's a hemorrhagic stroke. It also makes it a lot easier for clots to form. So that's also going to put you at higher risk for heart attack and also another type of ischemic stroke, an embolic stroke. So being that it's the silent killer, a lot of people are walking around with high blood pressure and don't know it.
Really? Because you don't have signs? I mean, you wouldn't...
Most people don't have... Sometimes a lot of headaches can be a sign of high blood pressure, but for most people it's very asymptomatic. And in our society right now, where we are at a very high sodium intake in our nutrition, that's probably one of the biggest culprits.
The salts.
Yeah, and they're lowering, the American Heart Association says 2,300 milligrams a day at max, but they really want people at 1,500.
Wow. Okay. Well, ways to reduce it. We're going to get out of time, but there are ways that you need to do it.
Look at your diet. Read labels and look at your diet.
Okay. In a nutshell.
Yes.
Karen Russell, Mountain Valley Regional Rehabilitation Hospital. Thanks for joining us. Ooh, really important knowledge. Keep your high blood pressure down. No tension.
Yeah.
Okay. More fun coming up right here. Arizona Daily Mix. Stay with us.